So I like to backtrack a little bit. You talked about seeing a professional to get diagnosed for autism, and usually that seems to be done by psychologists. So I think it'd be really great if you explained the difference between what a psychologist would do and what a psychiatrist does. That's probably the most common question we get.
Yeah.
And especially as it relates to our topic today.
For sure. Well, and as a psychiatrist, I have been called a psychologist
your whole life.
Probably as many times as I've been called a psychiatrist. So, so the education of a psychologist, let's first talk about that, and then let's talk a little bit about how they're different. But a psychologist has a different track, right? So in terms of their education, they'll get usually a bachelor's degree, maybe they'll get a master's in between, but then, a lot of times, the higher level psychologists are going to get a doctorate. And a lot of their focus is going to be, a lot of doctorates in psychology will be clinical, so it'll be clinical psychology. But a lot of times what they're doing is either they're focusing more on therapies, specific therapies. And so psychologists, I would argue, like a really good psychologist is going to be way better therapist than I am. But they will also a lot of times have experience in evaluations. And so they do a lot of studies or a lot of work in learning how to administer tests and how to, combine these together into a psychological evaluation, right? That's psychologist, right? A psychiatrist, we go the track of going to, bachelor's, then going to medical school, and then in medical school, we'll do 2 years of rotations, our third and fourth year, where we're exploring everything. So OB-GYN, gynecologist, surgery, internal medicine, psychiatry, but then also other things like, other options like radiology, pathology. And then we'll go to another set of training that can be typically from 3 to 5 years of residency specialization. And so that's where I became a psychiatrist. General psychiatrist, 4 years of specialization after medical school. Dr. Friday did 5 years, and so his last 2 years were actually child psychiatry, right? So he's more focused has more training on things like autism spectrum, right? Right. But that's the main differences between the two.